So we're joined today by Dr Emma Hyde. Emma's the president of UKIO and holds a number of roles within the healthcare diagnostic space. Emma, good to meet you.
Lovely to meet you too, Matthew.
Emma, if you could just introduce yourself, please, that would be really appreciated.
So hi everybody, my name is Dr Emma Hyde. I'm a diagnostic radiographer by background, currently working as an associate professor in diagnostic imaging at the University of Derby, also working 1 day a week as clinical director of the Personalised Care Institute, but probably of most interest for this particular recording, I am the president of UKIO. I was president in 2024 and will be president again in 2025.
So for those that don't know, UKIO, that's the UK Imaging and Oncology Congress, which of course had its roots as a radiology congress before that. I understand you've actually had an interest in the event for many years. Tell us a little bit about your background in a bit more detail and how you came to attend there in the first instance.
Yeah, of course. So I am a diagnostic radiographer, as I mentioned. I trained at Sheffield Hallam University and qualified in the 1990s, so I've been in the profession a little while. I started attending the precursor of UKIO, which was called UKRC, back in the 1990s as a student, and I have kept attending over the years. So I worked in a number of clinical jobs in the East Midlands. I worked at Nottingham, Derby, Leicester, became a CT and MRI specialist. I then moved into education at the University of Derby, and throughout that time I've always attended UKIO. My reasons for attending have changed over the years as my role has changed, but it's always been a fantastic opportunity to come and keep up to date with what's happening, to network and to meet the exhibitors in the exhibition and find out about the new technologies that are coming out.
It's interesting, Emma, that the name of UKRC to UKIO has changed over the years. But with that, I think we've probably in parallel seen changes in the nature of diagnostics in the NHS and the way that different disciplines work. What are the biggest changes that you've seen during your career?
Well, huge changes. As I mentioned, I qualified in the 1990s. So when I was a student radiographer and early in my career, we were still on actual film for starters. So we were still using a film that was sometimes processed manually in a daylight processor, or sometimes even going into a dark room to process those films. I saw the introduction of computed radiography, which started to come in the late 1990s and early 2000s. I've then seen the introduction of digital radiography, which came in a little bit later on in the thousands. I've seen the shift from being a radiographer working on a single slice CT scanner to multi-detector arrays, with now commonly in practice 64, 128, 256 slice scanners. As an MRI radiographer, I've seen us go from scan times anything from 40 minutes up to an hour for a fairly standard examination to now being significantly lower and able to use breath holding techniques. I've seen the explosion of interventional radiology and the way that that's really revolutionised how we can treat patients in the imaging department rather than needing to go to theatre and have a general anaesthetic. And of course, now over the last few years, the increasing use of AI, the potential for genomics and the potential for robotics. So massive changes over that time.
And with those changes, how far have you seen barriers breaking down between diagnostic disciplines? For example, pathology, radiology, radiography, everything that's really perhaps had been done in silos in the past. Is that joining together more so now? And if so, what does that mean for the ways that patients are treated and diagnosed?
Well, I think there's huge opportunities for diagnostic radiographers in the way that healthcare is changing and the way we are starting to look more at pathways and who is the best person within a pathway to do a particular thing. And we're looking at continuity of care, which from my point of view as a researcher in person-centred practice is really, really important. For me, one of the best examples of where that is already working really well is in breast services. So for some time here, diagnostic radiographers who have been working in breast imaging have been actually undertaking the reporting as well as the image acquisition. We have a well-established practice now with advanced and consultant radiographers who are then going on to do an ultrasound of the breast and taking biopsy samples. So I think this is a really good model for us to look at and consider how this kind of approach could be rolled out in other pathways. It's much better for the patient because one person can see them through all of that journey, and it's much better for the staff working in those roles because there's a real sense of job satisfaction from being able to do that.
And you talk about person-centred care. Of course, people are key in the NHS from a staffing point of view as much as they are from a patient point of view. And workforce challenges are probably more prevalent today in the NHS than ever before. I think now there's in the region of 1.6 million people who are currently awaiting diagnostic tests in the NHS compared to something in the region of 400,000, say, a decade or so ago. With that increase in demand, what's the real opportunity to address those challenges that are faced in the workforce at the moment?
Yeah, absolutely. So I think one of the biggest challenges at the moment is obviously recruitment and retention. You can't fill a leaky bucket. So we really need to work hard to address the retention issues that are affecting not just us in diagnostics, but across the board in health and social care. A big part of that is the ongoing pay disputes which are happening, but other parts of that link to some of the lack of flexible working arrangements and lack of investment in education and training. Some of those things are obviously way outside my sphere of influence, but some of them I do think are within all of our influence. So, and this is where my research into person-centred care, I think, really does have something to contribute. We know that in organisations where there has been a culture of taking a more person-centred approach for both patients and staff, this has proved time and time again a key retention tool, because for staff it boosts their job satisfaction, it boosts patient satisfaction measures, and that's really rewarding for them. And obviously for the patients, they're getting better, more person-centred care, so that's a better experience for them. So it's a win-win from my point of view.
Absolutely. You mentioned earlier about empowering team members to do more. I think, as you hinted at, the nature and the role of radiographers has changed significantly over the years. How do you think that's going to change into the future?
Yeah, I think there's going to be a lot of change. I think health is an area which is continually changing, and it doesn't just change across the board either. It varies significantly between different healthcare providers, between different regions, and even between the 4 nations within the UK. And I think that's one of the really interesting things that happens at UKIO. In our proffered paper sessions and in our education and workforce sessions, we get to hear about things that are happening outside of our immediate locality. So we get to hear about the empowerment that's happening, the additional training that's happening, the QI projects or research that's happening, and what impact that's had. So that's where people can share innovations that have happened in their practice or in their department. Often it's linked to enhanced or advanced or consultant level practice. But the key takeaway is when you sit and listen to those sessions, there are so many opportunities for us in diagnostics. It's about thinking where you would like to develop, what you would like to do within your role, and talking to your manager about what might be possible for you.
And then, as you say, sharing that development beyond the boundaries of an individual organisation, presumably sharing that so that you can spread innovation more widely. Is that key to what's happening now?
Absolutely. It's about not just doing things within our own silos. It's actually about telling people what we're doing. Very often we find that there's an assumption. People do a project, they make a change, through a quality improvement project, or they do some research, but they don't put it out there into the public domain. And so the learning that other organisations could pick up from that isn't possible. It's really important that we do share our work, we disseminate our work and tell people what we're doing, because very often we're at the forefront, we're innovating, and we need to share the possibilities with our colleagues.
And one of those areas that we might think about sharing ideas, sharing innovation, is technology. You described your own visits back to UKIO in the 1990s, and that technology was one of your interests then. Have the opportunities that were presented by technology then come to fruition, do you think?
Yeah, absolutely. I mean, I've already talked about some of the changes I've seen during my career, the move from film imaging to digital being one of those. There have been so many changes over the last 30 years or so that I've been working in the the radiography field. I think for me, the exciting bit is always how it makes things better for patients. If we can decrease our scan times, it makes it more tolerable for the patient, particularly in something like an MRI scanner. If we can use AI to help us make a more timely diagnosis, a more accurate diagnosis, and that's obviously better for the patient. So for me, it's all about how things make the patient journey better in lots of different ways. I think what's coming now, again, I mentioned some of these earlier on, is about how things like robotics could be used. We have some great examples in theatre for keyhole surgery, in pharmacy for dispensing. Where could we be using that in diagnostics? You can see possibly a support role for teams working in interventional radiology, some kind of assistant role providing consumables. But I think, the sky's the limit really here in terms of what the robotics could do to help and support us within diagnostics so that we can spend our time focusing more on the patient.
You talk about patient-centered care. So with that, do technology vendors need to think about the needs of different patients? So, for example, a patient that might have dementia, or a younger patient in pediatrics, for example, might have less tolerance for sitting on a scanner for longer periods of time. Is that something that needs to be considered here?
Well, I think many of the manufacturers have already responded to those sorts of challenges, so that we've seen, for example, in MRI scanning, the use of different scan protocols, fast scan protocols, for example, where you've got a patient who might be struggling to keep still because of potentially being somebody who's living with dementia or a different condition like Parkinson's that may be meaning that they struggle to stay still because of the involuntary movements that happen. But we've also seen loads of innovation around children, and there are so many pieces of radiology kit that are so children friendly now. It was amazing looking around UKIO and seeing some of the examples of that actually this year, and there's some of the really great things that are being done to prepare children for their imaging.
Absolutely. I mean, is that actually having a difference when it comes to capturing that quality of image and also the patient experience?
Well, that's it, because I mean, for us, as a CT and MRI radiographer, the number of times over the years that a patient would come along, it might be a child, it might be somebody who's just very anxious, but the walking into the room, seeing this machine, seeing what they needed to do, sometimes caused what we call anxiety-induced claustrophobia, which meant that they were unable to actually tolerate the scan. Now, if they can't tolerate their scan, they're not getting their diagnosis, which means they're not getting their treatment. So it's a really, really big part of patient experience, and actually has a massive impact on patient outcomes. So anything we can do to make the imaging examinations more comfortable, better for the patients, is inevitably then going to impact on the next steps in their pathway, and therefore we must be doing it.
And Emma, you've touched on things that are already interesting you. What are the biggest technological innovations that you're seeing at the moment that you're most excited about?
So there are lots of things that are happening at the moment that I'm excited about. I am particularly excited about some of the sustainability things that I'm seeing, that some of the manufacturers are really putting a lot of time and resource into developing more sustainable products and actually promoting to us in the diagnostic space about what that can actually do and the impact it will have. I think there's also lots of really good examples around health tech solutions though as well, which help us with supporting personalised care in particular. If we look at, for example, continual glucose monitoring for diabetes control or blood pressure monitoring for people with cardiovascular disease, there are lots and lots of examples there of small devices that we can wear that really support our overall health. And it's going to be interesting to see how those sort of things come into the diagnostic space. We've already got, for example, handheld ultrasound scanners, which are becoming quite commonplace in the emergency department setting. We're starting to see small mobile MRI machines, which can be taken into resus or ITU for head scans. So what's next? It really does make you think in 5 to 10 years' time, it's going to be really exciting to see what the new technology solutions are going to be.
And that's interesting, because I suppose when you talk about mobile scanners, things that can be located in different environments, does that change, well, firstly, who can do that scan? And secondly, where that scan can be done that's convenient for the patients?
With the case of ultrasound, sometimes it opens up some flexibility in terms of who can do the scan. Obviously, with anything involving radiation, that is a different conversation without a doubt, because of the radiation safety implications and the person operating it needing to be cognizant with that, with understanding IRMA and how to keep people safe. So I think it's not going to change the fact that a radiographer needs to do that scan, but it does open up the flexibility of where the scan is done, and that's the big key difference. Because if we don't need to bring an acutely ill patient down to the imaging department for their examination, that's a good thing, because we know that CT, for example, is often referred to as the most dangerous room in a hospital, because that's where the majority of the cardiac arrests and patients becoming critically unstable happen, because they're removed out from ITU or resus to have their imaging when they are very, very unstable, very, very unwell. So if we can take away that and we can go to them like we would do with a mobile X-ray, that's only better for patient care, isn't it?
Absolutely. And presumably you can also do more to take that imaging into the community as well if you have scanners that are mobile.
Yeah, and then that's the next step. We already, of course, have mobile units going into communities for things like breast screening. We've got CT, MRI, PET already going into the community as well, and have been for some time. And yes, I think we can see that going further. And of course, the rollout of the CDCs, the community diagnostic centres, are going to be a key way that happens. But with smaller technologies, there could be other ways that happens as well. It opens up a lot more opportunities for us, doesn't it?
Absolutely. I think one phrase I heard a chief executive of an NHS trust use in the north of England, which was the idea of X-rays on your high street, and why should patients be made to go into hospitals to have scans when they can actually access it at a place that's convenient for them. Hospitals should be about treating acutely ill patients, not necessarily screening or dealing with patients that in many cases are having scans done as precautionary measures. So is that something that you would agree with as an idea?
Absolutely. I mean, we saw that in COVID, didn't we? Where we really didn't want people to be going unnecessarily into a hospital setting, because we were, the social distancing measures, the isolating that needed to happen for COVID really did emphasize that why are we sending people into a hospital setting for those kind of tests? And yes, it's much better if they can have it close to home, somewhere very local to them. That means they're not going into a setting where they could potentially be picking up other things that then may impact negatively on their care. It's better for everyone, isn't it, if we can do it closer to home? And I look forward to seeing what Lord Darcy will recommend in his interim report when it comes out in September, because he's going to be looking at exactly these sort of things. And I wonder whether we will see a return to thoughts around polyclinics on our high streets, which not only can do diagnostic tests such as imaging, bloods, etc., but also can provide physiotherapy, occupational therapy, and all sorts of other things for people in a very convenient local setting.
Absolutely. This is all about access, presumably, and with that comes an element of equity in healthcare. If you can't access tests and diagnostics, then you can't get the care that you need. But taking this forward in terms of innovation, I think it would be wrong to not talk about artificial intelligence to an extent if we're talking about the role of technology in diagnostics. What do you think is the real opportunity here? We're seeing AI brought in to support the reading of chest X-rays, for example. But where do you see the biggest opportunities there?
Yes, I mean, obviously there are huge potentials for AI, which we're starting to see moving into practice. We've had several large-scale clinical trials now using AI as a second reader in mammography that have proved that there is definitely a role for AI to play there as a second reader. We've also got examples in the research now of AI being used to spot hot zones. So focusing the human reader on where to actually look, whether that's on a chest X-ray or whether that's on a pathology slide. I've seen examples of both in the last couple of months. So I think there's a huge potential, and I think the momentum is increasing, and I think we will see it speed up even more over the next few years. I don't think it's ever going to replace humans. I want to be really clear about that. I think it always takes the human, the clinician, to piece everything together and come to the official diagnosis. But AI is undoubtedly going to be very, very helpful for us in terms of speeding things up.
How do we make sure that in the introduction of AI that we don't lose the human element of patient care?
Well, for me, and I've talked about this many, many times when I've been presenting my research, for me, what AI gives us the opportunity to do is actually spend more time with the patient. If the AI is speeding up things in the background for us, that gives us more time to talk to the patient, to communicate with them, to make them comfortable. So it releases our time for additional patient care. And I think that's the opportunity that we need to be harnessing.
So back to UKIO, the focus this year was really putting people first, and that was at the centre of the Congress. What does that mean in practice?
So putting people first was directly related to my research interest. It means taking a person-centred approach about thinking about the individual and thinking about them in a holistic way. So we think about all of their needs. So we don't just focus on the fact that they're here for a chest X-ray or a CT scan. We think about everything else that might be going on for them and try and really think about how we tailor the care to them. So that means listening to our patients, thinking about their lived experience, thinking about how we can make things better for them. Importantly, though, and I did reiterate this lots and lots of times at UKIO and in the lead up to it, putting people first is also about workforce wellbeing. So if we want to provide high quality care, we need to have the reserves, we need to have the capacity to do that. And if we if we don't have the emotional energy left to do that, then we're not going to be able to provide person-centred care. So that's why at UKIO 2024, we had Doctors in Distress at the event talking about mental health of health and care workers. We had wellbeing sessions. So we had chair-based yoga, for example. We had meditation. Running in the event that was free for anybody to access down in the exhibition hall. We also had things like an escape room. So it was all around workforce wellbeing and thinking about how we provide people with the capacity to provide person-centred care so that they can be person-centred back in practice.
I think when you talk about the patient side of things of person-centred care, and you mentioned the fact that people are not just there for a scan, how can we think about that from a point of view of evolving the nature of diagnostics? So, for example, is this about breaking down barriers that might have existed between radiology, pathology, perhaps even areas like genomics, for example?
I think it is. And I think that example I mentioned earlier on about radiographers that have been able to develop their practice, extend their practice out to do things like not just the imaging and reporting in breast, but carrying on to do the ultrasound and the biopsy samples. That's a really good example, isn't it? We often refer to that sort of thing as a one-stop clinic. If we can create more of that kind of capacity where we are doing all the diagnostics in one attendance, that's undoubtedly better for the individual. I think what we have to be careful of, though, is that we have prepared the individual for that particular experience. It was interesting that one of our plenary speakers at UKIO talked about the fact that they attended a one-stop breast clinic during COVID, during their diagnostic journey, and it was quite overwhelming. They weren't prepared for it and all the different things that were going to happen in that consultation. And I think that really is the key, isn't it? Yes, we want to provide that one-stop approach, make things as convenient as possible, possibly, again, as we talked about earlier, on the high street as well, in a location that's better for the individual, but they need to be ready for that. So they need to be prepared for what is going to happen, and they need to have support there in place for them. And I think that was quite a challenge for our speaker, that they hadn't been prepared, and because of COVID restrictions, hadn't got anybody with them as a support during that experience.
So it comes back to really thinking holistically about that individual's needs, yes. What it is that you need to do to really guide them through that journey, so that they get the best experience and outcome from that. But,
yes, yeah.
And then in terms of wider takeaways from UKIO 2024, what were the biggest things that you took away, and what do you think people are taking from the event and putting into their own clinical practice?
Well, I think my biggest takeaways were this is such an amazing area of healthcare practice that we work in. We have a fantastic community. The buzz at UKIO 2024 was tangible. You know, you could tell how many people were there wanting to be innovative. They were passionate about what they were doing and they were driven to do it. So it was a joy from that point of view to see that buzz, to see what an amazing group of people we work with. I think in terms of the lasting impact that UKIO, I hope, will have, I think hopefully it will increase the focus on people, so patients and workforce wellbeing. I think it did shine a light on health inequalities. We had many comments from delegates that it was something that they hadn't considered before they heard some of our plenary speakers on the Monday and Tuesday of the event. And I think it supported workforce wellbeing and hopefully helped people to think about how to embed good habits to support themselves in their clinical practice.
And just to, I suppose, ask a question just around the current priorities that are being set out for the NHS. We're now seeing a period of transition in terms of course, government, and with that comes an opportunity for change, as the current government has said. What would you urge them to change, and what would you say they should perhaps not undo as a means of progressing healthcare forward?
I think the biggest challenge for them at the moment is the workforce. And I think the fact that we have such enormous waiting lists, if we're not going to be able to tackle those if we can't get the workforce right. So I think going back to some of those earlier points I made, the ongoing industrial action, the fact that that's having on the morale within the workforce, that's really, really considerable. We know we have so many people leaving healthcare at the moment because they are burnt out. So retention, we've got to think about how we keep the really high quality people we have in the professions. And we also need to think about training capacity, about how we change our models to support increased numbers of people coming into our healthcare professions to actually help us deliver the high quality care that we want to.
One final question really around the way that technology and the way that innovation is communicated in the diagnostic space. We touched on earlier the idea of innovation needing to spread, of people's own best practice and development, spreading those ideas. Do you think enough's done to really communicate the good stories of technology in action in healthcare diagnostics? Do you think there's an opportunity to do more there?
Yeah, I think there's always opportunities to do more. Events like UKIO are crucial to sharing innovation, to telling stories about what we're doing, hearing from the exhibitors about their new products, hearing from the speakers about what they're doing, things they've done within their organisation, talking to other delegates. It helps us to understand how we might bring change, innovation to life. But that isn't the only way, of course. We need to supplement that because not all of our community can be at UKIO or similar events at any one time. So we have to think about other ways to get the messages out there. And I think obviously there's a role obviously for marketing, for social media, for journal articles, for blog posts. So lots and lots of different ways that you can do that. I think the core of it is, though, the human connection that you get at somewhere like UKIO starts that journey, and then you can spread it out further through other channels.
That's great, Emma. Thank you very much for your time today. That's been really appreciated.